Hi guys, welcome back to Skincare Sunday. Dr. L here at Vital. We're continuing to talk about lifestyle and your skin health with the important topic of sleep today. Are you sleeping correctly for optimal skin health? What is it about the way you sleep that could be good for your overall health as well as your skin health and bad for your overall health and your skin health? Okay, number one thing when it comes to sleep is the amount of sleep. So most of us don't get enough. The ideal amount of sleep that you should have in order to optimize skin health is about 7 to 8.5 hours. So most of us are kind of towards the 7 mark if we're lucky. So trying to get in about those 8 hours of sleep is optimal for restoration of both skin health and overall health. Sleep is the time when the body brings in those immune cells to repair all the damage from the day, including free radical and oxidative stress on our skin. So it's basically trying to Pac-Man and eat up all that damage from the day to not allow that to age us. So getting enough sleep, allowing that tank to refill when it comes to working on those cells that help us reverse the stress from the day is about getting enough sleep. Another thing about sleep deprivation is that it can actually worsen inflammation in our skin, just like the rest of our body. So it's not just about rest and undoing damage, it's about oil production. Cortisol levels rise when we're sleep deprived. We're in a state of almost survival mode. And the body doesn't not only not able to repair because of that inadequate sleep, but it's also an inflammatory mode. That cortisol level drives oil production. So oftentimes I'll see patients and they're breaking out when they weren't breaking out before. They were doing great on their skincare. And I'm asking what's going on. Well, sleep can be the biggest culprit in that. If you're not getting enough sleep, you're typically stressed out, and there's a reason for that as well. So we have overall high cortisol, higher oil production, and now we're breaking out again. So we're clogging pores with that excess oil. So sleep is overall important for pathological things like acne in the skin and inflammation, rosacea. The second component of sleep in your skin that I want to talk about is how you are sleeping. And number one is sleep position. So if you are like me and most of my patients, you are sleeping on part of your face. So what does that mean? You are compressing part of your face. So you're usually kind of smashing it like that. And we're going to show you some photos of that over the week. So that compression of part of your face, one side usually, causes aging in that side. It causes volume loss over time. It will cause aging of that skin, followed by the fat pads to also age and disintegrate from that compression, followed by the bone itself under those fat pads. That bone will also shrink in addition to that. So typically the side you sleep on, I'll tell my patients, you sleep on your right? Do you sleep on your left? And how do I know? Is because when I'm looking at your face, I'm seeing those changes from that compression. So typically the eye is a little bit lower. So I sleep on my right. So my right eye is a little bit lower. That cheekbone is typically a little bit smaller on that side. Same thing with the jawline. With this angle right here, there's usually more wrinkles here. So when you smile and animate, you'll see more lines on that area of the face that you sleep on. So ideal sleep position is on your back. So let that back of your head where your hair is age all at once and get compressed all at once. Nobody really sees it. But that's also very tough to do. If you are used to sleeping on one side, trying to reposition that is very difficult, as I know for myself. However, guys, do not buy things that can help reposition you. For instance, positioning pillows, silk pillowcases, all that doesn't really matter. It doesn't make a difference. They're a waste of money. It's about where is your face on the pillow. It's not the pillowcase that's aging you. It's the compression. It's the pressure, the weight of the head on the face that's compressing that volume and causing aging. Two more quick tips for healthy skin when it comes to sleep. For my acne prone patients, if you struggle with breakouts, etc., please change your pillow covers and your sheets, especially if you cover your face with them frequently. Keep them fresh so that we don't build oil and dirt and etc. on those pillow covers that touch our face if we're sleeping on our face like most of us do. Keep them fresh so that you prevent that additional cause of congestion in the skin. Second of all, when it comes to timing your skincare and sleep, please do your skincare a little bit before you hit the pillow, because you're probably going to put your face on the pillow and you might lose some of those active ingredients in the pillow if you do that really right after you do your skincare. Even though our Zeo products absorb extremely quickly, just give yourself a little time to wind down, do some things before you get on that pillow, and let those ingredients dive deep into your skin to magically improve it. All right. That is all for Skincare Sunday with sleep in your skin. I think this was a fun topic. I hope you guys learned something with me. See you guys next time.